Disaster. Call for nurses. Emergency operation. Nurses. Wartime wounded. Nurses. And in every hospital in the land, the cry for nurses rings desperately in our nation. In war and in peace. Here is the house where Mercy dwells and walks in white shoes softly down the corridors of pain. With more patients than ever before, our nation faces a grave crisis. Lights on the call board, each a distress signal, are flashed to thousands of nurses who aren't there, who don't exist. She knows, for she has served for many years the gentle art of nursing, ever since the day, starched and proud and inspired by the ideal of service, she was graduated. That ideal is still bright and clear and rekindles itself in each class of incoming students. For the need is great, and the cause is great. There are never enough. 390,000 nurses are incapable of caring for all the people now seeking medical attention. One of these is Betty Hess, a determined American girl entering nursing school this year. One class she must take is anatomy, without which you cannot understand or make yourself understood in medicine. Chemistry, a basic study. The precise instruments of microbiology, tools to ferret out those almost inevitable enemies of health. And soon she'll have a student nurse uniform. Now she's the pride of her nursing arts class, even though her patient shows scant appreciation of her attentions. Betty finds that scores of simple things she did at home served her well, but they must be practiced with proper hospital precision. Betty starts clinical training by preparing a medication. Her exactness and her careful check of each detail in the delicate matter of dosage are important. Precision is absolutely necessary to the successful treatment of the patient, and the correct performance of Betty's job is watched by an experienced graduate nurse instructor. Someday, human life may depend on her precision. Treatment trays and those always present forceps. You'd almost think they'd find a simpler way to keep instruments sterile. But you learn, Betty, you learn by doing, and you get so that it's second nature to baffle the bacteria. And here, as everywhere, accuracy, forethought, and speed. No time to waste and no excuse for error. The doctor who will use this tray cannot take time to hunt for any instrument you might forget. By knowing they are all in order and by getting them to him promptly, you have helped him in his vital work. Getting the right things to the right places on time is of prime importance in the work of caring for the sick. Your skill makes this an easy task. Now, we get back to that medicine we saw a moment ago, remember? It was checked twice before. Now, here's a third check, this one in 2 steps. First, ask the patient her name. Then compare the card with this official one to make doubly sure. You'll find that knowing how to keep on pleasant, easy terms with the sick makes your task simpler and helps speed their cures as well. Betty is now an experienced nurse of 2 years. Her cases are so varied she'll find use for everything she has learned. Her hospitals serve the community, benefiting all of its citizens. This work gives scope for almost all the knowledge a nurse can get. Betty's background is now wide, and caring for this young patient is a gratifying experience. Training is like the job itself, an accumulation of habits and skills learned from each one. Accuracy in time, in temperature, deftness in every movement of the hands, and a constant determination that no bacterial invaders can be allowed. In surgery, technical perfection is idolized. So highly trained and coordinated are the hands and mind of this member of the surgical team, she is elegantly termed the scrub nurse, that they provide, as a matter of course, the right instruments at the right time. It's as if there were a link between her hands and the surgeon's brain. If there were not, if those lightning fingers faltered, their failure might spell death beneath that sterile sheet. The strain of an operation is almost overpowering, but the patient is okay, and Betty knows she did well. Even so, she's glad the supervisor thinks so too. The human touch is everywhere when you serve humanity, and perhaps this is most keenly felt in the obstetrical nursery. Here, a stern discipline keeps even fathers out, but Mr. Clark can present his card. And Betty, all swathed in sterile clothes, will see if Girl Clark cares to interview the gentleman through the window. Perhaps the ceremony that Betty will remember with the most nostalgia is the capping ceremony, the first great occasion, when after months of pre-clinical work, she was rewarded with the distinctive cap of her hospital. Once she had the cap, she knew she had passed the stiff requirements. The emotional satisfaction is deep, for this milestone is marked by ceremonial flames commemorating nursing's great guiding light, Florence Nightingale, the lady with a lamp, and her honor, the nurse.